I do. I well, I do and I don't. Hello, everybody. How are you? How are you? How are you? This is Dr. Monica of Deep Rooted Health and Wellness Med Spa. How are you this evening? Welcome to Talk Ed Tuesday, January 9th, 2024. I am really, really excited to be having these conversations with you tonight. This is our first of 2024's Talk Ed Tuesday, and we are really, really, really working with the technology to try to make sure that we are being seen on multiple streams. I am trying to make sure that we are on our YouTube channel. That's why I keep looking to my left, which is where we're streaming live. But I'm also on a platform so that I can bring a guest to you today. This is the first of 2024's Talk Ed Tuesdays. We are talking today about holistic approach to women's health, and this is the Cervical Wellness Edition. So we are pleased to bring you that and talk about a lot of different topics that women have around their vaginas and their cervix, and how to and what their options are on how to treat those. We have a special guest for you tonight, but I want to make sure that we are live on YouTube. So if you are on the YouTube link and you can hear and see us, please drop us a line, a one, to say that you are present and you are here with us. And I am checking on YouTube myself to see us go live. And I haven't seen us go live yet. So let us see, check back in to make sure that we are live. And I am still not seeing anybody. All right. Well, I apologize to you guys for the delay. I just want to make sure that I do see people who are waiting in the waiting room, but I don't see anyone in the chat. I apologize. Well, we are definitely going to continue on with our program tonight, but I will have to repost this on to our YouTube channel, but I did not want to leave anybody out. We're also going to go live on Facebook as well. So we want to make sure that those of our listeners who are on Facebook have an opportunity to tune in. Okay, well, we are not going to delay because of technology. Let us go live on Facebook because I still have a guest that I want to introduce to you. Y'all, one day I'm going to get this down so that I have no delays at all, and we're going to all celebrate together when I do. But the information is still important and the information is still good. We are now going live on Facebook. So if you have any friends, please tap and share that we are on live Facebook. You can see me now on my Facebook page um, through Dr. Monica. And please tell your friends to come and join in on our broadcast tonight. All right. So the reason why the Talk Ed Tuesdays are so important to me, that's because every minute counts, every second Tuesday, is that we have 60 minutes to really delve into some subject matters that are important to the community. Now, we'll do different topics each time that we meet, but we'll try to cover things that are relevant to either the month or that you all have brought to me that are important and relevant to you all. So one of the things that I thought was really relevant, because this is cervical health, National Cervical Health Month, was that we talk about, what questions women have around their female health and their annual exams, and the things that we should be doing differently, or that we can do differently to take better care of ourselves. And there's a lot of things that are out in the community that we take with a grain of salt as being real or relevant, and some things we've done for years, and maybe they're not as relevant as they used to be. So I wanted to kind of clear the air and clear up some subject matters. We won't talk about every solitary thing. It's not enough time in 60 minutes, but we're going to get to a lot of them. And if you do have questions, please put them in the chat. I do see we're live on the Facebook channel. And so if you are on Facebook, please do not hesitate um, to join in and ask some questions. If you have friends who are on Instagram, please have them to join in and ask questions as well. Come on over to the Facebook. We're having some technology difficulties getting us live on the YouTube channel, but I do want you all to come in and join. So when we talk about female health and we talk about cervical health, first let's talk about what a cervix is. So a cervix is the actual opening to the uterus, where the uterus is the organ that we as women have that we carry our children in. It is the organ that our menstruation comes down from. It is the organ that is the actual connection between our the outer world, the outer vagina, to our fallopian tubes and our ovaries, where we carry our eggs. A lot of people don't realize that the eggs that a woman is born with are the only eggs that she will have for the rest of her life. That's a really, really important point. And I don't think it was an accident. When the Creator God made us, we are divinely walking around with the fruit of the earth from the moment in which we're born. And so that is the reason why it is so important that we understand and that we care for our bodies like the temples that they are. Can you imagine that you are walking around from the time of your birth with creation, with the makings of creation? An awesome task and an amazing responsibility. So how we care for ourselves, how we take care of ourselves is literally really responsible for the future generations. Now, how are we different from the male species? The male species, well, they actually make sperm over and over again, and they make it into a ripe old age. So they get chances to start over again. They make new sperm, they get rid of them. They make new sperm, they get rid of them. But we have a certain number of eggs that we are allotted, and those eggs are there for us to care for throughout our lives, through our fertility lives. And then at some point, we are at an age where we're no longer supported by our hormones to support that egg. And so that being the case, it is imperative that we as women know from a young age how to really care for the organ that is called the vagina, the uterus, the cervix, the fallopian tubes, and the ovaries. So that's what we want to talk about tonight, about some of the ways and that we have been taking care of them, and maybe some ways that we in the future can look at taking care of our female organs. So some of the topics I just want to bring up, kind of what we're talking about tonight, is the wellness care of our female organs, and that's your annual exams and the things that we should be looking out for annual exam, and some of the standards that are placed to take care of getting our wellness and annual exams done, and some of the things that I want you to think about as possibly alternatives to those standard exams that may be beneficial for you and maybe even keep you out of some trouble. Something you can teach young women about, so that they have a better and more fruitful fertility life as well. We're going to talk about infections, vaginal infections, where we will look at, some ways that we are taught to take care of vaginal infections, and then there's some alternatives, which is a word that I say tongue in cheek, because sometimes alternatives are really rooted in a lot of ancient culture, and so they're not necessarily new waved things. They're things that we probably lost for some of us in our culture as our history here in the United States. So sometimes the things that are quote unquote new wave are really old history. So we want to talk about some things that we can do to take care of the vagina, and how we can better care for the cervix, and also just general health maintenance care of the vagina. And then there'll be some fun things also that we're going to talk about, like mask for the vagina and facials for the vagina. Um, those are more popular things now, and just really the benefits versus what benefits they may actually even have for us. And then at the end, I want to offer you a special that we will have at Deep Rooted Health and Wellness Med Spa here in Lawrenceville, Georgia, because we want to make sure that you have the opportunity to take care of your own vaginal health and your own female health. So we're going to give you some offerings on that. But to start off, I want to introduce someone to you who is a dear friend of mine. I've known her for a very long time, and she is a caretaker on many levels, but she has a business, a service that she offers that is really something that is being heard about much more now. And it is, but yet it is still a very old, has history in the female wellness industry, and culturally for multiple cultures. So I'm going to introduce you and bring on my friend, Miss Temico Myers. I want everybody to give her a warm welcome where you are. Yay, Temico. Hey,
Hello, how are you
how are
doing
you?
today?
I'm good. I'm good, girl. How are you?
I'm doing great, doing great.
So wonderful. Tamika comes to us from Winfield, Louisiana tonight, and I'm going to let her tell a little bit about what she does there, and how she services women in the Winfield and surrounding areas with something called a yoni steam.
Yes, yes. Well, as she said, I'm Temico Myers. I'm here in the big old town of Winfield, Louisiana. I have a salon, which is Unique Designs here in Winfield, and I've been in business for a while, but I added yoni steam into my service because I found that what it was doing for others and did for me, that I needed to share with other women that may or may not be experiencing some of the same issues that maybe me or some of my friends or something like that have experienced before. So that's about me. I'm a stylist, a mother, a grandmother, a wife. So I got a whole lot of hats.
Absolutely, absolutely. And so I think everybody can relate to all those hats that you put on and you wear so well. And I love the fact that you mentioned that you began this journey with the yoni steaming because it was personal. Watching your family and friends go through things, and then the things that you're for yourself, that it was beneficial for. We can kind of start there. Well, first let's make it plain. When someone says yoni, I was really trying to make sure that people were really clear on what that is, because I think that's a buzzword, but people don't understand that actually that word has meaning. My understanding is that it's got the Hebrew meaning gift of God,
Yes, yes.
gift of God. And I think that correlates really well with what I was saying initially, is that how amazing that we come to earth, we come through the birth canal already, owning and carrying all the eggs that we will have for our lifetime. And
That's
what
right.
better way to look at it as but the gift
Mhm.
of God, because that's where life is coming from. So
That's right.
tell me a little bit about, your understanding of yoni and the history, if you have any, of where it came from. Do you?
Well, let me tell you, as you said, that it is a Hebrew word that tells us it's a gift from God, meaning that it literally, we don't, as women, don't really realize how much of a gift it is, because we are able to give birth through the same canal. And the
Mhm.
thing is that we as women, we do a lot and we neglect ourselves.
Yeah.
I want to say that first of all. We do a lot and we neglect ourselves. But a lot of people calls it yoni steam, and then others may say a vagina steam. But it comes, like you said, an ancient um, healing property that many people used. And here it is that they've used it back in Africa, in Asia.
Yeah.
Um, a lot of the medicine women used it to heal other women.
Yeah.
I've known that like Korea, it's like
Yeah.
far, far.
A lot of cultures,
It's
a lot of
abroad.
cultures.
Yes, but
Egyptian.
what it is that we just sit. It's a thing where we sit on either a pot or a bowl,
Hmm.
of steam. We call it a steam pot, and we have water where you infused with herbs,
Hmm.
all natural herbs,
Yeah.
in it to heal your body.
I think that the history of yoni is really important because a lot of times when things come of new age, people they foo-foo it because they think it's just kind of a new fad. And when you're doing research on the yoni steam, you'll get a lot of
God.
pluses and minuses. And I will say, as a board certified family medicine physician, I can't ignore what the adverse effects that people talk about for the yoni. But I think that, um, put in context, the yoni steam has a lot of benefits, and we can't ignore something having this much history and benefit, that if used correctly and with an educated practitioner who knows how to use it as a therapy, there's a lot of benefits from it. um,
Mhm.
when you talk about benefits from yonis, what would you say the benefits of the yoni steam have been, are for your clients?
Well, it has a lot of benefits. Whenever I think about it, the first I have to tell you about me,
Yeah.
about my story, because with thinking about it, I have always been a young lady that um, cycled 3, 4 days. I thought I was doing it big. I didn't have to worry about those 5, 7 days.
Right.
Um, but as I got older, my body began to change and it began to need something different than what I was giving it before.
Hmm.
And so with that, my body began to cramp more, and I began to really bleed more. And I didn't understand exactly why I was doing that, but the bleeding part I could deal with, but the cramping,
Yeah.
that literally almost took me out. So as I began to try to find out different ways that I could do it, because I can raise my hand and say I hate taking medicine.
Understand.
But
Yeah.
yes, I was trying to figure out some type of way that I could do something that would help me. And so I started researching about foods and everything. So I came across the yoni steam, and with that, I ran across this young lady, Monique Jetter, that
Mhm.
was telling her testimony
Mm.
about it.
Okay.
And as she told her testimony, I began to ask questions, and she began to tell me that it was a she had some herbs that can help me. And so
Mhm.
as I began to talk to her more, I began to research it, and I began to steam. And when I tell you that it helped me tremendously, my pain level went from a 10 to a 2.
Really?
And yes, it did. It went from like a 10 to a 2. And so what I had to do was that I had to let myself know that this is something that helped me. So I need to continue to do it. And so with doing that, Steam, it has brought me a long ways,
Hmm.
because when I tell you that I was in pain, I was in pain. So
Yeah.
some of the things that other women might be experiencing that it may help is if you're suffering from BV, and you don't know exactly what's going on with it, then because we smell ourselves before anybody else do. If you
Right.
find out something going on with that, then you check it out to find out what's going on. If you are suffering from fertility issues, you want to have a baby and you don't really know exactly what's going on, try it first. If you
Yeah.
are having, like I was, cramps, heavy bleeding, um, it's just, if you haven't even, I have a client that comes to me that she suffers with boils.
Yes.
So um so we started doing her steams um at least once every 2 weeks to
Hmm.
start off with, to make sure that it gets in her system, that she can handle it. If you are having painful sexual experience, if you're having sex and you're having pain, then find out, we can put a blend together for that as well.
Yeah.
It's you're itching, fibroids is one of the things. If you having cysts,
How about your menstrual cycle just in itself kind of help regulate it? Does it help with that?
it does, it
Hmm.
does,
Hmm.
it does. And then also, let me tell you this: I'm starting a new herb to help myself, because I'm beginning to have hot flashes.
Mm.
So
Hmm.
it helps with that as well.
Yeah.
So it's a broad amount of things that it can help. But I would always say to go to your herbalist and tell them what's going on with you, and then they can put you a blend together that would help you.
Well, that's perfect timing because I think that's also really important to understand is that the herbs that are used can be directed correct
Hmm.
to the particular issue that you're having. And so I think that that's one of the things for me that interests me about yoni steaming the most is that, I'm a big proponent of herbs when we're talking about taking, orally taking herbs, but
Hmm.
we have to remember that our skin is our largest organ. And
It's our large.
so the things that we put on our skin get absorbed into the bloodstream. And
Hmm.
so our yoni is skin, of
Hmm.
different types of skin. And so we can absorb things that way as well. We do steam for our nasal
Hmm.
cavities. We do steam for our lungs, for our babies when they're too young to take all these
That's right.
pharmaceuticals. We put a humidifier next to them, and I know everybody out there can relate to getting a little bit of Vicks vapor rub put on
That's
on their chest with the steam or on
yes.
their feet. So steam is not something that we are foreign to, and this is something that has been used. Heat and cold have been used for many
Hmm.
many years to in the treatment of our bodies, uh,
That's right.
and so the cautions that people will have about the steam is, of course, you have to be careful about making sure that you don't burn yourself, especially if you're trying to do this yoni thing yourself, because that
Hmm.
tissue in the vaginal area is very sensitive.
That's
But
right.
steam is at the right temperatures can be very opening to the pores, and if the pores are there and there's actually herbs coming up there, then we can definitely see how there'd be some benefit there for sure. Do you have
That's
any particular herbs that are your favorite, that are your go-tos?
yes. Well, let me tell you. We have a thousand plus herbs, but
Hmm.
let me tell. I'll tell you some of my favorite.
Okay.
Okay. Whenever I do a blend for me, I can do basil. Is
Hmm.
one of them. It has a really deep healing property to it.
Hmm.
Uh, it can soothe it warm to your pelvic floor. It helps with
Hmm.
that. One another one that I use is calendula, and
Hmm.
I might be pronouncing that wrong, but it's one that I really love. It helped me with my menstrual cramps.
Hmm.
Uh, it's an anti-inflammatory herb.
Hmm.
I really like that one. Let me think about another one. We have the queen of them. I would say is chamomile.
Chamomile, and everybody
I
is
love
so
chamomile.
familiar with chamomile, right?
Yeah,
Chamomile.
it's very good. It relieves the pain that you may be suffering from.
Yeah.
That's one of the good ones. Peppermint. We all love peppermint because what it does is that it kind of rejuvenates you.
Yeah, yeah,
It
and it
gives you
opens your
energy.
pores up. It opens your pores
Yeah,
up, and it really
yeah.
kind of stimulates the blood flow. So that's
That,
rejuvenating. Anytime you can stimulate the blood flow, you're doing a good thing. So that's great.
mhm. Yes. Lavender is another one. It's a antimicrobial. It cleanses just as well as some of the other ones does.
Mhm.
And mugwort, that's another one.
Yeah,
I would
heard about mugwort.
mugwort, yes, but it's more of a all around herb,
Mhm,
all
mhm.
purpose.
Yeah.
You can use that one. That one is really good. It's an anti-inflammatory as well.
So
Um,
detoxification is something that I understand it's really great for detoxing the
mhm,
body, and I think that that's
detox.
something that's really important. I think one of
Mhm,
the other things that I hear about, and then from an adverse effect or to be cautioned is that you have to be careful that you're not washing away the good parts
back-
of the
mhm,
vagina, right? Because the inside of our bodies and the outside of our bodies have bacteria and fungi
that's
on them. That's
mhm,
important. They actually help to make sure that they're the army. They keep make sure everything stays at bay.
that-
How do you avoid um, like washing away the good or being concerned about washing away the good? Is it the number? Is it a time frame? How often should you get it done? Can you do it too much? How do you avoid that?
what I always recommend to my clients is that you start out with 2 times a month.
Okay.
Start out like that, and if you're having any particular issue that you want serviced, then what you do is that you come a little bit more. So do maybe once a month
Mm-hmm.
until you get it under wraps,
Gotcha.
because we want everything to be in line together. And then once you no, let me back up. I'm sorry. If you are having issues, you want to do it once a week. That's what I'm trying to say.
Okay.
Once a week.
Okay.
And then once you get everything aligned out, then you can start doing it once a month just to keep it good. Maintenance. Maintenance. So my the way I do, I always tell my clients, let's start out with twice a month. Let's see how that goes. And then if you're having like a really big issue, then we could do it once a week. And then we get it under wraps, and then we could do it once a month just to maintain, just to make sure you're good.
Yeah.
That
So
you can stay there.
the interesting part is that, when you're having infection, the body can heal some things by itself. Even yeast infections, the body can heal by itself if it is put back in balance. Bacterial vaginosis, when we say BV, we're talking about bacterial vaginosis. Bacterial vaginosis is not an STD; it is an overgrowth of
That's right.
bacteria, and because bacterial vaginosis is the actual, growing of this bacteria, the growth of this bacteria, and because the body has the ability to rebalance itself, sometimes it just needs the proper atmosphere or environment to do that. Do you find that the yoni helps to get the vagina into that proper environment, to help to kind of restore that balance?
I have seen that, yes, and it helps with getting it back in balance. Whenever it fell off, because I know that we all go to the doctor. Saying when we need, when we don't understand,
Yeah,
because we might not really understand exactly what needs to be done. But the thing is that once I found out that I could put my balance back where I needed to be with just herbs, it made a big difference.
Yeah.
Because and let me tell you, my hat goes off to you, because that's one of the things that I learned from you years ago. You were a person that taught holistic health before you gave the medicine, and that really stuck with me. And so that's one of the things that made me want to learn more about herbs. And another thing about it, Monica, is that the fact that the herbs that we are talking about that you would use, you can ingest it. You could drink it as a tea. And so you could drink it as well as steam with it. So I mean,
and that's
balance.
that's one of the ways that where something is healthy and natural, is that if you can ingest it into your oral mouth,
That's
then
right.
you can feel more comfortable putting it on your skin or having it around your body. We do have a couple of questions. One question here from Ms. Clark. Is there any age restriction on starting a yoni steam?
I would tell the girls, if you have young ladies, that's what I'm trying to say. If they started their cycle, I would give them maybe, I wouldn't say 12, 13. I would say 16 on up.
Okay.
And even with older women, because I have a 70-year-old client that comes because she suffers from dryness. I have somebody that's a little older that comes, that she said that it just don't feel right. You know what I'm saying? When I say don't feel right, it's like it's irritated more. And I started her on the herbs. So I would say 16, 18, and then let's take it on out. Whatever age you need to from there.
And that's, so you were right on point, because that was the next question. It was does it help with moisture? Katrina asked, does it help with moisture? Yeah. So, once again, being cautious of temperature, which, as someone as experienced as Temico is, she's going to be able to make sure that those things, but people do yonis at home. But I would dare say that, you want to be very, very careful about the herbs that you use, making sure that they're like something that's organic and clean, making sure your water is clean, because everything that you're using, right, is being absorbed into the skin. So making sure that you're using a good, clean product, and then making sure that it's safe, are going to be really important. But yes, Temico says moisture is absolutely something that you can help with. Know that when you get past the age of 40, that's when we all start to have what these symptoms that we're talking about are. Menopause, perimenopause is when you may feel some vaginal dryness, and you may feel some of these issues with pelvic floor loosening. And so what my understanding, and you can tell me, Temico, your experience, is that this steam really helps with all of those things.
It does. It does. And I wanted to say that whenever you said about doing it at home, you want to be careful also with what herbs you order online. Make sure they don't have oils in them. I
Mm,
know a lot of people they're doing different, and not to knock anybody, but they do it different. They want to insert different
mhm.
things, but you got to be careful about all that,
Yeah. Is
because
there
you don't
any
want to mess up.
insertion at all when it comes to a true yoni? Is there any insertion, or is it really just the steaming?
You're supposed to just steam. You
Gotcha.
shouldn't put it in there in order,
Mm.
because you want anything that your body can do to heal itself. You want it to come out, not you know.
Come out.
So
And so that's the thing that people also have to realize that the body will, and we'll talk about that a little bit further on in the program, but the body does naturally, and that's, I guess, one of the things that some doctors will say is like, well, the body naturally, will douche itself. It'll naturally clean itself. So is the yoni really cleaning it? And I would dare say yes. I don't think yoni, in my medical opinion, my natural medical opinion, is that the yoni is there to clean necessarily. It is there to, is a therapy.
that's right.
So the cleansing for a healthy vagina happens when we have discharge.
That's
We
right.
have discharge, and that discharge can definitely tell us whether or not there's a problem going on. If that discharge has an odor, then there's a problem going on. If that discharge is itchy, there's a problem going on. If that discharge has color, there's a problem going on. But what also we're saying, and I'm agreeing that there's more than one way to handle the problem. Before we had antibiotics, what do you think women did
That's
to
right.
care for their vaginas? Sex has been around since humans have been around. So sex is a natural product. Semen inside the vagina is a natural, a natural relationship. So
Hmm.
women had always have had ways of refreshing themselves and fixing issues that may come up. And to me, it sounds like yoni historically, culturally, was probably one of those ways of doing that.
That's right. That's right.
Now, is there any recommendations you have on what to do after a yoni? Is there any things you should do or you shouldn't do for any time period? What's the follow up?
I would say, just clean with a cold um, wash rag. Not, you don't have to do anything hot. Take your cool shower. Drink plenty of water.
Hmm.
You just like whenever you get a massage and they release the tension and everything in your muscles. Drink plenty of water. And that's one of the things that I had to pick up because I got fussed at.
Hmm.
That's right.
Hmm.
But
Hmm.
I'm a pro at it now. I'm a pro at it now. But
Wonderful, wonderful.
but
So,
it's
so
not.
not a whole lot of aftercare that you need to be concerned about afterwards. Got it.
Just
Got
making
it.
sure that you talk to
Wonderful.
your herbalist, making sure that you use the right things, and and you just go from there. Don't be afraid, because that's what we're here for. You ask, and no question is a crazy question, um, because that's what we're here for.
Absolutely, absolutely. Well, Tamiko, I have to say I'm really proud of you. I've known you for a long time, and I was really excited when you opened up this area of your business because in different areas of the country things move a little bit slower as far as
Right.
coming to. And I really want to congratulate you for bringing that to this wonderful ancient treatment to Louisiana because I know that. People all over the world, much less our United States, are in need of more natural ways of learning how to take care of themselves. And I really
Right.
want young women at a much younger age to understand historically how it is best to take care of yourself. So thank you for doing that, and thank you for coming and sharing.
Thank you for inviting me. Thank,
Absolutely, absolutely. We really appreciate you, and we hope you come back some time and talks about some other things for us
yes, anytime.
anytime. All right. Well, thank you. We're going to let Miss Temico go, and we're going to talk about a few other things. If you guys have questions, I see old friend Miss Christy Wright Carter on Facebook. Excited to see her. I see some faces. Hi, Dr. Sam. I see you there. Thank you guys for being like flexible because of not being able to get on YouTube, but I am going to repost this video on YouTube so you all will be able to, those who can't see Temico's beautiful face will be able to see her face as well. We're going to continue with a few more subjects before we get out, because remember, we got 60 minutes. Every second counts, every second Tuesday. I'm only going to keep you for a moment. So we have a little bit more I want to talk to you all about. Thank you, Temico, so much for coming on tonight with us.
Thank you.
All right. All right. Well, thank you so much. That was Ms. Temico Myers from Winfield, Louisiana. She has an amazing, amazing business there. I know that I see some of her lovely patients and clients and on already on the Facebook page. So we're excited that you guys joined in, and Temico has brought some great information for our viewers here as well. So tonight, for those of you all who have joined in late, tonight we are talking about holistic approaches to women's health, and this is the Cervical Wellness Edition. Happy National Cervix Health Month. For all of you out there, I want you all to be good to yourself all of the time, but especially be good to your yoni in January. So what we've talked about so far is we've talked about some natural ways of cleansing and taking care of the outside and steaming the inside of the our yoni, or our God's gift, which is yoni in Hebrew. But let's talk a little bit about some other things that are also that come up in the community. And so one of the things that Temico and I were discussing was about infection. So normally, customarily, if you start having some vaginal issues and you start having discharge, or you start having an odor, or you have itching, we run to the doctor. You guys come see me, and we're looking for, number one, a diagnosis, and number two, we're looking for, hey, Miss Valerie, I see you. Thank you for joining in. I see you, Katina. I want you guys to know, when you guys come to me, the first thing you should be looking for is, what is this? What is going on? What is the diagnosis of what's going on? After we ask some questions, we then are able to kind of assess. Sometimes just the physical exam itself is enough for me to figure out what exactly is going on. That's by odor. That's by the actual texture or the color of the discharge that you've gotten on, or the history of what you all are giving me. And so, antibiotics a lot of times is the treatment of choice. Sometimes an antiviral is the treatment of choice, and sometimes an antifungal is the treatment of choice, depending on what we have in front of us. So that being said, sometimes that doesn't work. And for a yeast infection, diflucan or fluconazole, generic name, is the most common thing that people will expect, which is a tablet for yeast infection. We also have suppositories of antifungal medications that you can even get over the counter. For bacterial overgrowth, as we talked about, BV, there's an antibiotic that we'll use. And for STDs, there's antibiotics. That's chlamydia, gonorrhea. Trichomonas are the most common ones that we think about, and those can be treated with antibiotics. But sometimes when these are resistant, then we have really issues with what do we choose next, or if we've tried to use a treatment over and over again and it's not working, what do we use next? One of the things that has been used and people have been successful for, number one, if you're just having an imbalance, number one thing to look at is your diet, because people don't realize that your diet has a direct correlation not only to your internal gut health, but the vagina health. So, you need to make sure that your diet is not too high in sugars or high in processed foods. If your diet is high in things that are toxic, then it's got to come out one way or the other. You may find that because of your diet or your blood sugar, you're more prone to yeast infections. So, I'm going to ask those type of questions first and ask whether or not, what are you eating? How is your diet? Has something changed? Has something changed with what you put on your body, such as a lotion or even what you wash your clothes in? Because those chemicals that come from detergents can sometimes be irritants and cause you to have urethritis, which is inflammation of the area where your urine comes out of, or vaginitis, which is basically inflammation of the vagina. So you have to look at all the external things that you might have newly put on or you've been doing for a long time that has changed the flora, which is the actual composition of the inside of the vagina, the organisms that are there. So if we go through that and we don't find that there's been any changes there, or we make some corrections there and it's still a problem, there's something called boric acid that a lot of people have been known to use, that is used for not only bacterial vaginosis overgrowth, but also yeast overgrowth. And so that is another option when you feel, when they tell you that there's nothing else that can be done. Boric acid is something that is been used and used successfully to kind of reestablish, or at least to get under control. But I want to say to you, if you go down that route, know that you have to reconstitute now the actual normal flora. Remember, that's the actual bacteria and the fungi that live normally in the vagina. You have to reestablish that, and reestablishing that actually will help to prevent these things from coming back. So you say, well, how do you reestablish that? We reestablish that by probiotics. The same probiotics that people were talking about that we take orally, there are strains of the lactobacillus, which is what we're using when we're trying to regenerate the vagina. We reestablish that by taking those lactobacilli so that they can actually get to the vagina. Now, there have been some people who talk about actually putting yogurt into the vagina itself. I would caution you to be very careful about putting just anything into the vagina, because it is such a delicate organ. The tissue there, the pH there is all very, very, very delicate. So the things that we put into our mouth are all going to come out through our organs, through our skin. So know that what you put into your body will come out and will help to balance your organs. And there are some very good probiotics for the vagina in particular that you can get over the counter to help with that restoration. So I want to offer you that as well. Another thing I wanted to talk to you guys about tonight was the regulations, or what's put out as what the rules are as far as your wellness and how often you should be doing that. So you guys know I'm a board certified family medicine physician. I've been in practice for 27 years. Now it seems like a drop in the bucket for all the things that there are to know about medicine. But I will say that over those years, these rules and regulations have changed numerous times. And a lot of times they're the national regulations that we put forward, or recommendations that we put forward, are based on not just your best health interests, but a lot of times it can be based on financial benefits or cost. And insurance has a lot to do with it, because it costs insurance companies money to take better care of us. So for those who have insurance, it's important. It can absolutely be there in the case of emergency, but it also can restrict you from taking better care of yourself. So I mean by that, currently the recommendations is that every woman at the age of 21 should have their first pap smear. But I, Dr. Monica, have definitely recommended to some young women, to have a pap smear earlier than that. And the reason being is because if you are sexually active starting at a very young age, and I say very young because I'm calling that around 12, 13, 14. And for those people who are shocked, that is what we see in my office. Not long ago, I had a 14-year-old who was pregnant in my office. these things still happen all of the time, and they're not always um, from non-consenting young women. This is a choice that some young girls are making. But what also we need to understand is that the more sexually active you are, the more at risk you are of STDs, and the more at risk you are of HPV, which will turn into cancer if it's the right type. So I implore mothers and daughters and women to talk to each other about, actually, if you are sexually active, take ownership of that and take better care of your health, and don't wait from the age of 14 all the way up to 21 before you go and get a gynecological exam. Now, they look at it as the risk, outweighing the cost, but there is no cost for your life. There is no cost for your vaginal health, because you could have an STD, you could have HPV, you could have a bunch of things and not check on it because your pediatrician or your gynecology says it's not time yet. So I want you to understand that these are all just recommendations. But at the end of the day, if you think that something is going on with your body, you need to go check it out. You need to go see someone, and don't wait for a regulation or a recommendation to stop you from taking care of yourself. So please, 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 if you become sexually active at a younger age, or you have a child that's sexually active at a younger age, there's one thing to be, on top of it and got them on birth control, but please don't ignore the fact that they are being exposed to viruses, HPV virus, which is what leads to cervical cancer. Don't ignore the fact that they do need to be seen by a gynecologist even at a younger age than 21, because they are doing activities that put them at risk for having disease, having infection, having changes that go on with the cervix. So I wanted to make sure that I mentioned that. The other thing that I wanted to talk about, and kind of goes along with what Temico was speaking about, when we were talking about just the cleansing of the vagina itself. It is really important. And I was having a conversation with my staff, and I have some 20 some year old staff, and they keep me young, because we are always laughing about generationally what I know versus them. Most of the time it has to do with music. We like to share with each other about music, and see who recognizes whose music. But oftentimes we often get into other subjects that are a little bit more serious. And we were talking about douching the other day, and I was so pleased that these young women were adamant that, nobody douches anymore. And, when we were coming up, that was when that transition really was going on, because my mother's generation, they were good to have a douche bag in the bathroom. And, if you were a curious young lady like I was, you digging through the cabinet trying to find something, and you like, what is this? And then, it progressed into a more sophisticated, portable douche that you could buy at the pharmacy, because we were told that it was important to clean the vagina, or if you were having a smell, to clean the vagina. And so it's really wonderful that my young ladies at the practice were very adamant that we know better than to douche, not to douche. Now, excuse me, they did not necessarily know all the reasons why you shouldn't, but they knew they shouldn't. So I'm saying it out loud. I'm saying it for the record. If you're old school, because I have clients who are in their 80s. If you're still of that mindset that you need to douche, please, please, please do not. And the reason being is that what you're doing is, you are two things. You are washing away what is naturally there to protect you, and actually increase by washing it away. Remember that bacterial vaginosis we talked about? You are increasing the chance of the overgrowth of that, of those bacteria that are going to cause you discomfort and overgrowth, infection, bacterial vaginosis. I just have to say a shout out to my big sister, Dr. Salika Just Buddy. Michelle, excuse me, is on the line, and she has absolutely been my, I guess, my partner in becoming a doctor since we were little girls. So Dr. Just Buddy, Michelle, welcome. Thank you for tuning in. It means a lot that you're here for me. I want you guys to understand that the body is going to naturally take care of itself. For the most part, if you do right by your body will do right by you. Your vagina will do right by you if you do right by it. I often get questions about, oh, I have discharge in my underwear. It's more than it used to be. Well, I will say to you all, remember that every month, during the month, we have hormones that cycle and change. And that cycling and changing of hormones actually changes the actual consistency of, and even the smell. What you eat can change even the smell of that vaginal discharge. So all discharge is not bad discharge. Sometimes you look down and you just have a flush of something in your underwear. That's your body douching. That's your body getting rid of what it needs to for the month. Also, when we talk about the cervix, understand that there are different times of the month when the cervix is ripe for pregnancy and when it's not. It's regulating that. And so the mucus that's in the cervix even changes based on the time of the month. So understand that the body is doing a lot of things on its own that we don't need to correct, because when we correct them, we cause a problem. We cause a problem. So very, very important. Don't douche, don't douche, don't douche. Let the body do its own douching for itself. If you find that you want to do something that to not cleanse the vagina, but to soothe the vagina and maybe do some herbal things to just kind of make yourself feel wonderful, then think about looking at a yoni, but only do it after doing your due diligence and doing it with someone who absolutely understands what herbs are beneficial, what are dangerous, and then also just be cautious and then listen to your body. If you do that in something and you start having issues, listen to your body. Let your body tell you what you need to be doing and what you don't need to be doing. And then if you have questions, always obviously check in with a health professional. Okay. We're almost out of time. We've got only a few more minutes. I'm looking to see if there's any more questions. Oh, I see my sister Yolita is just joined us. I am so excited she is here. I see people from all over the country. For those of you all who have been traveling with me for a long time, know that I have been and lived in many states and have had the pleasure of making so many friends and sisters. And I'm so happy that you all are joining in tonight. For those who may be joining in late, know that this will be on our YouTube channel, Deep Rooted Health YouTube channel. I will repost to make sure you all have the link. We were unfortunately not able to go live on there, but I'm so happy that you all are joining in, and you will be able to go back at your leisure and watch the program, as well as all the rest of the Talk Ed Tuesdays every second Tuesday of the month for the 2024 calendar. I'm excited about what we've got coming up. We talked about gynecology exams. We talked about bacterial vaginosis. We talked about you having your annual exams, and we talked about the yoni steaming and douching. I think we've talked about quite a few things. I want to make sure that I give you all something to go away with for coming and staying and listening to me tonight. So at my practice, Deep Rooted Health and Wellness Med Spa, this is a practice of wellness. For those of you all who don't know what I do, I'm a board certified family medicine physician. I specialize in functional medicine, and my goal, my practice, my heart and my passion is committed to wellness. It's committed to getting people back to health, getting them kind of educated in what is the best thing for their health, to prevent disease, to treat disease, and to do it as naturally as possible. And I'm able to do that because of my background in medicine. So I know when medications are dire and necessary, but I also know when it's time that we can move in a different direction so that we can prevent ourselves from having to be on so many medicines. That being said, I offer a lot of procedures that are non-invasive at Deep Rooted Health and Wellness Med Spa. One of which is called Cliovana. Cliovana is a sound wave technology for those women in particular who are having issues with enjoyment of sex. When we're talking about the yoni, one of the organs that is on the yoni is the clitoris, and the clitoris is our organ of pleasure. It is simply made for pleasure. And when we have gone for long periods of time, whether it's because we had babies or maybe you haven't been as active or just gotten older, sometimes the clitoris is not as sensitive. And so I have women come to me who maybe are on hormone replacement or have come to me and have done a bioidentical hormone replacement, and they got the va voom voom voom. They want to be intimate with their partner, but when they do, they're not feeling fulfilled. So they're finding that they're not actually having time, or they're not actually getting time to actually, or feeling like having an orgasm. A lot of times that can come from clitoral nerve degeneration. And so I do a sound wave technology that actually re-stimulates the blood flow to the clitoris, and therefore increasing the blood flow also increases the nerve response. And this is a process that has really changed a lot of women's lives, definitely postmenopausal women, but I even have women who have had either trauma, sexual trauma or emotional trauma or birth control. They've been on birth control, which may have numbed their clitoral response. And they get this procedure done and have amazing orgasms, amazing sexual experiences with their partners. So with that being said, I am offering you all the Cliovana, which is the procedure that is a 2-week 2-week stint, where 15 minutes each session, 4 sessions in the whole 2 weeks. I'm offering that, plus I'm throwing in a free gynecological exam, and I'm doing that because my business is a cash-based business. Most people don't realize that there are a lot of people out in the world that don't have insurance, who are not taking care of themselves because they think it costs too much to take care of themselves. So I am throwing in a free gynecological exam. That means that I'm throwing in a free pap smear for anyone who gets the Cliovana procedure done for the month of January. And I'm also taking off $150 off of the Cliovana. So you get a free gynecological exam, which includes your pap smear, which we'll send off for pathology to make sure that there's no HPV there and that you don't have any cervical cancer. That is what a pap smear is for. And you will get your Cliovana to not only know that your insides are healthy, but that your outsides are doing all that they can do. So you can be all that you can be. So I'm offering that for clients who call and make an appointment here in January, and I'm excited to offer that to you. And so if you have any questions about that, please do not hesitate to call our office. We are at Deep Rooted Health and Wellness Med Spa in Lawrenceville, Georgia. That's located at 1130 Hurricane Shoals in Lawrenceville, Georgia. Please call our phone number, which is 770-847-8104. Let me say that again, 770-847-8104. You can find us on the web at www.deeprootedhealth.org. www.deeprootedhealth.org. You can find us on social media. We are on, Instagram, YouTube. Please click and like this video. If you're finding this video on YouTube, click and follow, become one of our followers. We are going to be doing so much more on YouTube. This is another opportunity to really spread the word. I even now am on Pinterest. And of course, we have Facebook that we're on, and I even have a TikTok. So you can find us on all the things, Dr. Monica, Deep Rooted Health, and we just want to really connect with you all. If you have any questions, if you have any friends who this would be important to, please like and share for them as well. Well, you guys, we're out of time. We're 5 minutes over. I want to thank you so much for coming tonight and talking about your cervical health on National Cervical Health Month. I love you guys, and I can't do this without you. So please, please, please join in again in February, the second Tuesday in February, where we will once again make every minute count. I'm Dr. Monica of Deep Rooted Health and Wellness Med Spa, and I want to wish you an amazing 2024. Let's do it together. Let's get it. Bye.